You may already have seen many ultrasound images. These B-mode images showing many shades of grey. But what are we actually looking at? And why do ultrasound images look the way they look? First of all, ultrasound images are often commended for their so-called tissue echogenicity. There are certain regions in the image which are bright. These are images with a large echo, and they're called hyperechoic, such as in this case. Other regions are more grayish. They are called hypoechoic. They have a little bit lower echo, like at this location. And there are even regions in the image which might be completely dark. They don't show any echo, and these regions are called anechoic. From an earlier video you may remember that in ultrasound images we see variations of acoustic impedance. Now a tissue has a different acoustic impedance than its surroundings, and that gives an echo from the surface of the tissue. But also inside the tissue we have many regions, very small regions, with variations in acoustic impedance, and each of these regions gives a small echo. So that creates the ultrasound image with a large echo from the surface of the organs and smaller echoes from the interior of the organ, the interior of the tissue. But it's not just the echo that we look at in ultrasound images. The echo from an object or a series of objects very much looks like the ingoing pulse, and the frequencies in the echo are more or less the same as the frequencies in the pulse. The ultrasound signals coming back from the tissue are called radio frequency signals or RF signals. Don't ask me why. But it's not very useful to show these radio frequency signals in the image, because the frequencies are much too large and the resolution of your monitor often will be insufficient to show all these high frequency details of the ultrasound image. So in practice, the signal is being filtered in such a way that the tops, the peaks of the echoes are connected to each other, like is shown by this line. These are the so-called demodulated echoes, or envelopes of the ultrasound signal. But why do ultrasound signals often look so grainy, so noisy, so speckled? Let's have a look at two objects very close to each other, at a slightly different depth in the tissue. We can have the situation that the two echoes from these objects are aligned in such a way in time that the peaks of one echo coincide with the valleys in the other echo. And in this case, they interfere in a so-called destructive way, and the net result is a lower echo. But now if one of the objects is shifted by a quarter of a wavelength, the echo of that object will shift by half a wavelength. And now the maxima of the echoes of both objects coincide, and the minima coincide, and then they amplify each other. And this is called constructive interference. Now a tissue consists of a large amount of these reflectors, so what we get back is a kind of cloud of echoes. Some of these echoes amplify each other, and other echoes cancel each other, and other ones do something in between. And the result is this so-called speckled image with these whitish greyish spots. Now speckles often are a nuisance in ultrasound imaging, so in some machines there is an algorithm that filters out these speckles to make a nicer image, smoother image. So it's much more than just the echoes that we see. Some echoes amplify each other, other echoes cancel each other. But the variations can be smoothed by the ultrasound machine, giving a nicer image to you.